Hello, and welcome back to the Careers Mare podcast with me, Jacob, and my colleague, Jordan. If you're feeling the blues from this long run up to Christmas through the dark days of Advent, we've got just the thing to cure what ails you. Because we've got a lovely old doctor in the house. There is a doctor in the podcast. Ladies and gentlemen, please, is there a doctor in the podcast? This man's having a heart attack.
Please, is anybody on this podcast a doctor, a junior doctor called George Cool?
He's actually called George Cooke, Jordan. Don't be silly.
But he is cool.
But he is cool. He is a very cool dude, and he has some pretty swish jackets.
A lot of nice jackets.
We know George from university. Surprise, surprise. He was in the Comedy Society for a stint while we were there, but he was a bit more advanced in his education than we were. He's very funny. He's a lovely man. This was actually the first time we'd spoken to him properly for a long time, so it was nice for us to get up to speed with him as well. And I think you're really going to enjoy listening to him talking about being a doctor and talking about a lot of other things.
Now, please, somebody get us a doctor. So, George, the thing that we ask everyone when they come on here is, what was your first ever job?
So I'm going to take the definition of job quite lightly here, and I'm going to go back to
Get off. Go on. Go on, I mean it. Go on.
I'm going to destroy the entire format of this podcast. I'm going to go back to my childhood because I grew up on a farm, a working dairy farm. So I was kind of roped into doing a lot of farm work from quite an early age, and I didn't get any pocket money, but I was expected to help out on the farm a lot. So I did lots of kind of odd jobs, ranging from quite sort of idyllic, sweet jobs like feeding the baby calves.
Did the baby like calves?
Always hungry for more calves. So some very sweet jobs, and then some other quite harrowing jobs as well. So I got taught how to drive the tractors about 12, 13 years old. And one of the jobs was to scrape up a load of the cow poo, right? And you'd scrape it up into this big sort of cesspit, which I got taught was called the lagoon. And I feel like most people, when they think of a lagoon, they think of like tropical island, peaceful paradise. Whereas, the lagoon at home was, a pit of, liquid cow poo. And I was told that the lagoon is very dangerous because there's a crust. There's a crust of hardened poo on the top. But if you were to walk onto it, you'd fall through the crust into liquid dung, and you would drown in the cow poo. I was always terrified of in films if a character like fell through the ice and they'd be trapped under the ice. But in the farm equivalent, you're trapped under like the solid poo in more poo.
Does that happen on every farm? Because I mean, I've been on farms before. I've not seen a lagoon of cow dung.
It's kind of kept round the back of the sheds. Like it's not like
every farm.
on the shop front,
Yeah.
But I'd see the dog like running over the crust because obviously the dog was light enough to not fall through. But I was always so terrified. And when you're driving on the tractor and you're kind of pushing the poo into the lagoon. I'm sorry, this is very kind of like poo based. Once the scraping mechanism kind of got stuck, and the kind of front of the tractor I was on started lifting up, and I was like, "Oh God, this is it. This is how I die. This is how I die. 13 years old, drowning in cow poo."
That'd be a great place to hide a body, wouldn't it? If you killed someone.
Yeah.
Because who's going to go looking in there?
Yeah. and it would probably break down, and who'd know none the wiser.
Yeah, you say probably, George. Your eyes lit up there, thinking about your first kill.
Yeah. Well, my first job was actually, working for the mafia, but pretending to be a 13-year-old boy working on a farm.
If you had to kill anyone and hide them in the lagoon, who would it be? It has to be someone you know.
I don't know if anyone springs to mind that I would want to kill.
That was the correct answer, George. Well done.
Yeah, podcasters that ask me really, intrusive questions like that, they get a little bit too close to the. I'm drowning.
Yeah,
that's the noise they tend to make.
Yeah. I was going to ask. You probably know this as someone who grew up on a dairy farm. Do cows drink milk?
Well, the calves did. The baby cows did, because I'd feed them.
Well, that's what it's for,
milk.
Isn't it?
Yeah. I suppose
it's a general idea, mate. Yeah.
We forget
that was our target market.
Yeah, we forget that milk's target market is calves.
Yeah.
Because I feel like milk's target market is me. But actually it's
Just
calves.
You. Yeah. The sole
That's
consumer.
That's what I say out loud to myself every time I drink milk. I say the target market of this is me.
Glug glug glug.
Yeah. Do you like milk?
I like milk and cereal, but I didn't drink straight milk.
From the udder.
No.
Have you ever done that though, working on a dairy farm?
I haven't squeezed an udder and directed it into my open mouth. That's what I'm asking. But we did drink milk from the farm. It was unpasteurized, so it was really thick and creamy. And
like raw milk.
Delicious, yeah.
You wouldn't buy unpasteurized milk. That's probably not legal, is it?
I'm not sure, to be honest, but the milk that we drank from the farm, it'd been thoroughly filtered, but it hadn't been pasteurized.
Oh, okay.
Yeah.
Is that all right? That's all right then to drink? Because I thought it had to be pasteurized, or else bad things would happen. well, I guess that makes it easier to like transport and sell. Like it makes it
probably makes it last a lot longer. Yeah. It's a bit embarrassing, but I don't really kind of know what that entails. I basically, I grew up on a farm and did these odd jobs, but kind of quickly realized that I didn't really want to be a farmer, to be honest. And kind of enjoyed quite a lot of academic things and was interested in lots of different things, but didn't really want to follow my father's and my grandfather's and everyone else in my family. Didn't really.
Oh,
follow
really?
their
How far did it go
footsteps.
back?
As far as you can go.
Really? Oh, that's great.
Yeah, mum's side and dad's side of the family, all farmers.
Oh, I love that.
It's a bit when you do like one of these genealogy tests. Mine's quite dull because, like, for the past 300 years, all my family's from the same area. They're all farmers. Basically means I think I'm inbred.
Makes sense.
Yeah.
Was there any disappointment from your family that you didn't want to be a farmer?
If there was, it wasn't felt. And I think they were quite happy for me to do something academic. I don't think they really kind of saw it as a disappointment. And I kind of feel so grateful for that, because if I was a generation before, there'd be no question that I would absolutely have to take over the farm. So I asked my dad, I've asked my dad several times, what would you have done if you weren't a farmer? And he just can't comprehend the question. He just can't think of any other job because it's all he was ever going to be. And, when he was a child, there was no question that he could or would do anything other than that.
So you did lots of jobs on the farm. You tended to the lagoon. Apart from your lagoon duties, what were your other duties on the farm?
Well, I was promoted to head of chickens at one point when I was about 14. So I looked after all the hens. So I'd feed them, I'd collect the eggs, and I'd muck them out, and I'd sell the eggs to the local pub which was great because basically that was kind of my way. Didn't get pocket money, so that was kind of my way of getting a little bit of cash. And it was great. I love my little chickies, my little hens. They were sort of kept in this orchard, so they're indulged with quite a lot of different fruits. So they'd peck at the apples that would fall from the tree, a few plums and sloes and damsons, and they loved that. Yeah, and so I'd feed them at the beginning of the day, and then I'd have to shut them in at night because of the foxes. And unfortunately, a few times the fox did actually manage to get in. And so once or twice, the whole kind of flock of chickens would be dead by the morning, basically.
They killed all of them?
Yeah.
Wow.
Yeah, leave none alive. I mean, I
It
don't
didn't
really
eat
know
all
like
of
what
them,
the...
though, did it? Surely.
No, the fox would take one or two, but kill all of them.
Why? That's so mean.
I know.
Just kill the ones you're going to eat if you have to break in.
I mean, really,
if you're listening.
if they're thinking about sustainable ways of eating, if they just took one or two and then come back for more later on when they're still fresh kills. I don't know what that fox was thinking, but anyway, there were a couple of times.
The most the best way of conserving the lost nutrients in the chicken would be to eat the fox, because the fox has absorbed the nutritional benefit of the chickens. Presumably.
Who's eating the fox here?
Well, you.
Oh, okay.
Someone. That should be what happened. Every time a fox eats some chickens, you hunt the fox down and you eat it, and then nothing's been wasted.
That sounds like one of those speeches that like a soldier would give in the trenches. Like, for every 5 of us they kill, we'll kill 50 of them.
And because they ate my friends, I'll eat them. Yeah.
Tally ho, boys. So, at what age did you stop doing odd bits here and there on the farm and then move on to other things?
So I guess the age where I did the most of the farm work would probably be from 12 to about 15. And then as it became clearer and clearer that I didn't want to do farming, I would kind of like angsty teen. I'd be like, I don't want to do this, and kind of put up more of a kind of fuss about having to do kind of family duties. And then when I was kind of about the age of 15, I was like, maybe I want to be an architect, because I played The Sims a lot and love kind of like building houses on there. So I was like, yeah, this job seems the one. And so it's kind of at that age where my interests in other things developed that I kind of petered out doing farm work. And I think my dad kind of understood at that point that, yeah, that's something that I didn't want to carry on.
That's interesting, because it's normally about the age of 15, isn't it? When I think especially boys tend to really latch on to something. And really, it's part of becoming your own person, I think, isn't it?
Yeah. I mean, for a long time, I remember thinking as a child, I really didn't want to grow up. I wanted to be young forever, not have any responsibilities. I didn't want to get a job. I didn't want to drive. That freaked me out as a child. It kind of seemed so bizarre to me that people are driving around like 60 miles an hour and staying on the road. I think it's that fear of driving.
It is bizarre.
Yeah, that made me think, I don't want to be an adult. I don't want to get a job. And so when I was a child and people were asking me, what do you want to do when you grow up? I'd kind of palm them off with, a half-assed answer. I'd usually say the job that was most in front of me, like postman or milkman, because I didn't really give it much thought as a child. But then when you're kind of 15, 16, you're kind of forced to think about your future, really.
Well, yeah, you got your GCSEs then, haven't you? And you know, then school's telling you, right, you've got to pick these subjects for what you want to do in the future, because then you've got to do your A levels after this. So that's when it starts. You get a bit more structure in your life of like, right, enough messing about, time to actually think about what you want to do.
Yeah, and as a 15-year-old with no life experience, well, I didn't have any life experience as a 15-year-old, you're told to make decisions that will affect the rest of your life. Yeah, which is always tricky. So I kind of, I was like, maybe I want to be an architect. So I got some work experience with an architect firm and seemed quite flashy. But I spent one day with a guy who really didn't like his job. And he was like, don't be an architect. It's really dull. It's really boring. He basically hated his job and kind of just unloaded his kind of
Yeah, and they thought, let's put George with that guy
Yeah.
when he does his work
Yeah.
experience.
yeah. The guy that
Strange
hates
choice.
his job. Yeah.
Because we don't want any more architects. Let's crush his spirit.
Yeah. I'm really not sure why that happened. Anyway, so I kind of realized maybe I've only said I want to be an architect because I like video games that kind of involve that. And also I quite like design, but I think that was more of a hobby. So I kind of thought, what do I want to do more as a long-term career rather than just a bit of a hobby? And I quite like sciences, so I kind of did the classic science A-levels. And then the school that I went to loved to push people towards medicine and those kind of careers and degrees that they can say they've got X many people doing this, that, and the other. So I was like, okay, well, I'll get some work experience because I'll do some volunteering work. That's what you need to do if you're going to apply to medicine. So that led on to a couple of, well, not paid, but kind of jobs that I do regularly. So I volunteered in a nursing home, and what else did I do? Oh yeah, I worked as a mealtime feeder. That's probably not the right word for it. I'd go into hospitals at lunchtimes, and I'd say, "Does anyone need feeding?"
And then the security guard would come up to you and say, "Excuse me, sir, can you?"
Yes, I've got a hot pie. Who wants some hot pie?
And you'd have your tabard.
I genuinely had a tabard.
And your hairnet.
I didn't have a hairnet, but I genuinely had a tabard that said like mealtime feeder or something like that.
And it had Mr. Feeder sewn into
Feeder.
it.
Rub-a-dub-dub, let's eat some grub. No, it was a genuine like volunteering organisation, and so you'd ask the mates on the ward, does anyone need feeding? And it was normally patients with very bad dementia who normally would just have a meal plonked in front of them, and because their dementia was so bad, they wouldn't recognise it as something they have to eat, or maybe they couldn't even pick up utensils to feed themselves. So you would be there to either encourage them to eat or to kind of physically help them do it. Because so often you have little ladies that go into hospital for whatever reason and don't end up getting the nutrition they need, and they become very, very frail, and then significantly impacts their mortality. So it's really, really important for especially little old nanas to get as many calories as they can. So often they'll be given, if they're going to eat a chocolate bar, they'll just be given loads of chocolate bars. Because even though it's not the most healthy food, it's calories, and they need calories. Yeah, I'd often sit next to a little old lady who's probably got quite a bit of dementia, and I'd, spoon food into their mouths. And most of the time they would, just open their mouths and chomp, chomp, chomp. And because you had to keep on trying to give them as much food as possible, because often they'll take one or two mouthfuls and they'll kind of lose interest or not want it anymore. So you got to kind of find a balance of obviously not force feeding them, but encouraging them to have as much as possible. So often I'd go, "Come on, dear, just a little bit more." And they'd say no, but they'd open their mouths. So I was like, well, that's kind of a form of implied consent. So I'd, and they keep on opening their mouths. And so I'd go, okay, a bit more. Yeah. I'm not sure if any of you Harry Potter fans?
I was when I was young, so I'm fairly conversant.
Did you see the films?
Yeah.
I think it's the sixth film where Harry and Dumbledore
Half-Blood
go
Prince.
that's the one. They go into a cave, and Dumbledore
Harry has to keep feeding Dumbledore. Yeah.
And Dumbledore's like, no, and like he's like spouting gibberish, and you're like, come on, Dumbledore, come on, eat a bit of like cottage pie. And I think in the film,
didn't help that you
like,
called them all Dumbledore, though. I bet that really confused them.
Yes, yeah. And there's a bit where he's like, "No, kill me," and Harry's like, "Come on, a bit more." Yeah, sometimes it did feel a bit like that, but actually what you're doing, if they're really batting it away and you've reached your limit, you kind of like go, okay, that's as much as they're going to accept for today. Let's move
I
on
mean,
to
it's
next one.
so much like feeding a child, really, isn't it?
It really
And
is.
that's the thing that people always say, isn't it? That the beginning and end of your life, they're quite similar in a lot of ways. And I think that's and obviously you
Yeah.
lose a lot of dignity, unfortunately, at that part of your life, and that's
Yeah.
part of it.
I didn't quite do the choo-choo train or here comes the airplane.
No,
I thought that might
that's
be
good.
a bit disrespectful.
Yeah,
Yeah.
not exactly the same, but similar.
Yeah. Yeah.
Wow. Well, I mean, that's this. I mean, working at a care home and then doing that's like the perfect practice for having a good bedside manner as a doctor, isn't it?
Yeah, and they were really useful kind of skills to learn to sort of navigate the potential awkwardness, and also just kind of learning to be friendly
Yeah.
and to acknowledge their dignity, but also to acknowledge the practicalities of what's going on as well. So not sort of, I can't think of a better word than pussyfooting around some of the real challenges they have. Because you might think, oh, it's quite awkward to, put food in an adult's mouth, but some of the things you just have to crack on with.
Yeah.
And yeah, if you're doing medicine, sometimes you just got to kind of roll up your sleeves and go, okay, this might be a bit awkward, but for the sake of this person's health, you've got to crack on.
And would you say that's where your spark for medicine came alive, doing those voluntary roles?
Yeah. It's really cheesy and played out to say you want to do medicine because you like sciences, you like helping people. But genuinely, if someone does medicine, that is really the reason why they do it, because you have to. And when you're doing these kind of like caring roles, you might not get a sense of adrenaline as you're doing it. But when you walk out of the care home or the hospital, whatever, you really do get a sense of like, yeah, actually, I think I've done something quite good here today, even if it's just something that might be quite sort of menial. Actually, you've worked in an environment, you've worked as part of a team that does some quite amazing things.
Yeah, I think there's a sense that in society we know that there's a certain amount of misery that has to be gone through and miserable jobs that have to be done. And so it is quite a good feeling when you feel like you're pulling your weight in that. I think that if you go through life and you feel like it's only ever been other people that have been doing the difficult, unpleasant things, like an obvious example is when the police have to go and tell next of kin that their relative has died or something like that. Like that's
Yeah, it's funny you say that, because I was literally just going to say I had to have quite a few conversations where I'd ring up next of kin and say their relative has passed away.
Oh wow.
Yeah, and that was always obviously a difficult conversation, but you learn techniques. The university I went to, Southampton Medical School, sometimes gets a bit of a rep of being a bit of a GP factory. But actually, I think one of the things they did really well in teaching us was preparing us for a lot of those difficult conversations that you inevitably will have to deal with as a junior doctor. And when you're doing night shifts, a lot of patients that die in hospital tend to die overnight, usually in the small hours of the morning. So if a patient's died at like 4 o'clock in the morning, I tend to leave it till about 8 o'clock in the morning to ring next of kin, because there's no point in ringing them at 4 o'clock in the morning. It's just going to distress them because they've been woken up. Anyway, so it would usually be the last job I did at the end of a night shift was to call next of kin up. And you kind of have your techniques and things that you absolutely cannot say and things that you should say. So I'd often start off with, confirming who I'm talking to. And I'd say something like, I was called to go and see Mr. and Mrs. So-and-so by the nurses. And when I examined them, I found that there were no signs of life. You kind of give that warning shot, and then you give a pause. And that pause is to stop you waffling, because in those situations it can be really hard to just kind of go blah, 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 because you're feeling quite anxious about it. But also it kind of allows them to then say the big D word, or it allows them to ask you questions. And oftentimes they'd go, "Oh God, if they died," because they usually know that their relative is very frail, and most of the time, when patients die in hospital, the relatives know they're on the way out. And if they kind of say nothing, then you have to kind of lead the conversation on a bit. But some of the things that you can't say is you can't be vague about it. You can't say, "Oh, Mr. or Mrs. So-and-so is in a better place," because it could mean that they're on the private practice ward, or it could mean, they're in another cubicle. And there's all sorts of sort of language and cultural barriers that you have to get over. You can't say, you can't really say they passed away, or what are the other kind of like euphemisms for people that have died?
Moved on.
Yeah, you can't say that. That's vague. You have to say the D word. You have to say they've died. And it can be so hard to say that word, because in hospital, that's the worst thing that can happen to one of your patients, really, is if they've died. And so it's really hard. It's a real lump in your throat. You have to push yourself off a cliff to say the word, "They have died." Because it's so easy to go, "Oh, they pass away." You just have to say it. And then once you've said that they've died, again, you leave a pause. You let the relative respond.
And do you find that generally they tend to get off the phone quite quickly after that, or do they want to keep asking you questions, or how does it normally play out?
The question they almost always ask is, "What next?" Because it's such a dramatic event. People just go, "Oh God, what do I do now?" You don't really think of the logistics of what happens when your relative has died, because you just think about their death. So you have to say, okay, this person's I can't remember the title of the job, but this person's going to contact you about the death certificate and the logistics of what happens.
Have you found that it's gotten easier over time having those conversations, or is it one of those things that just never gets easier?
I think it does get easier over time, for sure. It's never easy, but it gets easier. The first time having to say the D word, someone's died, or they're dead, was really, really difficult. Just to kind of physically squeeze it out of my mouth was just quite challenging. But it is something that you get used to. Well, I may not get used to, but it gets a bit easier. Yeah, but obviously every single conversation that you have with relatives is going to be different. And so you can never approach it like a repetitive task that's the same every time.
Do you say died or dead?
Oh, as in like they've died or they are dead?
Yeah, so I say, when I examine them, there's no signs of life. And just to confirm to you that, say the name of the patient has died.
Right.
Yes,
Because that sounds a bit less harsh somehow, I think, than so and so is dead.
Yeah.
Yeah, the language is so crucial there, isn't it?
It is, because you want to be gentle. You want to be gentle, but you have to be clear.
Yeah.
Unambiguous. And then another tricky conversation that you often have to have is the do not resuscitate conversation, which can almost be hard in a way, because you have to often have the conversation with the patient themselves and say, if you get really, really sick and your heart stops, we're not going to perform CPR on you and try and restart your heart. And the reason why you do that is because that patient is often so frail that the chances of bringing them back once their heart has stopped is so small, it's very, very unlikely. But also, if you were to bring them back alive after their heart has stopped and they're technically dead, their situation might be so much worse. So their heart might have stopped for long enough that causes them permanent brain damage. And so they might be brain dead or significantly paralyzed, or they might need so much support with their breathing, they have to go on ventilation. And so their life, if you bring them back, their life might be unbearable. And often you have to realize that the chances of bringing someone back by doing CPR is very slim. If it's a young, healthy person, obviously the chances are better, but it's still pretty slim. You know, in TV and movies, when someone does CPR, it almost always brings them back.
Clear.
But yeah,
Yeah,
exactly.
yeah.
But in realities, it's it doesn't often happen. And like I said, the reason why we do these do not resuscitate forms is because even if we do, and also it's kind of it's a dignity thing as well. If you're a little old nana who's 90 years old and very, very frail, and the family is there, does the family and does the patient want people to be jumping up and down on their chest, crushing all their ribs? Do you want that to be the last memory or the last moment of your life? Almost all the patients are very happy to sign a do not resuscitate form, but it'd be quite harsh because I kind of think, God, yeah, I'd want you to do everything you can to bring me back. But obviously, I'm talking as a 31-year-old adult, not a 88-year-old, someone who's lived a full life. So your own perception of your life can make those conversations quite difficult.
That's something I wanted to ask actually, because I know personally the way that I have come to terms with death is reminding myself that this is just how I feel right now. Because when I was younger, and particularly when I was a teenager, I was really, really, really petrified of death.
Oh, me
And
too.
as I've gotten older, I've realised that the reason for that is because I'm in my prime right now, and I don't. I haven't even begun
Maybe a
to
couple of
peak.
years ago.
I haven't even begun to peak, so shut up. But what I always remind myself is, when I'm, like you say, 88, and I've had my full life, I'm sure at that point I'll want to get off this ride. So I'll be a lot more comfortable with it at that point. Is that for you, and particularly with doing this job, is that something that you've had to come to terms with? Being, because you're surrounded by death, aren't you, in the job that you do?
Yes. So bring this back to childhood, working on the farm. Even at a young age, on a farm, you're surrounded by death. Animals are dying around you. Vets are coming in. Sometimes the vet can't do anything. Animals die. And because we lived on a farm, we had quite a few pets as well. We had dogs. We had horses at one point. And there were times where there was like a very tragic time where one of our horses was, something awful happened and it was dying. And then one of the dogs a few years later died in quite a traumatic way. And I guess everyone with pets learns about death through pets, but when you're on a farm, there's loads of it. And so that probably helped with the transition a bit. But like you said, Jordan, I still am very, very afraid of my own death and my own mortality. And you have to take your feelings out of it. You have to put yourself in their shoes rather than your shoes. To do that, you have to be very open in your questions and try and get to know what their priorities are. It might be that a patient wants you to do absolutely everything you can, or it might be a patient's priority that they don't want blood transfusions, or they don't want surgeries, or they don't want this and they don't want that. And you can't assume what a patient's priorities are. So you just have to have a lot of these open conversations, quite a lot, because it's not for us to decide how do I put this? We're not going to treat all the patients exactly the same. We're going to do everything we can for all of our patients, but we're going to treat patients in a way that is most respectful for them. Does that make sense?
Yeah. Because you've got to obviously account for
the
fact that not everyone has the same viewpoint as yourself, which is interesting because that goes against human nature, I think, is that we tend to assume that everyone else thinks the same way we do or should, or and often in our worst moments we get angry at other people because they don't have the same values or opinions or beliefs or feelings as we do.
If someone is of sound mind and they have capacity to make decisions, you can't force them to do anything. Sometimes you're really baffled by patients' choices. So there might be a patient where you say to them, look, we have to amputate your foot because otherwise Otherwise, it's going to spread and it's going to kill you. And they're like, nope, I don't want you to do that. They don't have a death wish. They just don't want to be treated like that. And if they have capacity, you can't force surgery. You can't chop someone's foot off against their will, again, if they have capacity, because that's assault.
Yeah, I mean, it's human nature, I guess. It's hard to weigh a doubt against a certainty, because in their mind, the choice is I might die or my foot's definitely going to be cut off. And even if the certainty is less serious than the doubt, still will go, oh, I don't want the bad thing that's definitely going to happen.
Yeah, I know what you mean. Yeah. But it can be very frustrating sometimes, because you're like, oh, I know what's going to happen to you. And you kind of think, but you have to stop yourself and think, I can't do this job and have the mindset of, I know what's best for you.
But often you do, of course.
Yeah. That's
that's what I was going to say. Really, is like, with the age of information, I feel like so many people now. It's the classic thing of like Googling your symptoms, isn't it? Or thinking that you know about your condition because you've looked it up and you've done your own research. Is that something that you found you have to battle against quite a lot when people say, well, no, actually, I do know this thing. I know what's going to happen.
Yeah, I mean, what I've noticed is that it's there's usually a generational divide in that older people tend to prefer it when doctors tell them what to do, and they kind of like that paternal way of being treated. Like, the doctors told me to do this, I'm going to do this, and they kind of follow the doctor's word by law. But often the younger generation, they want to know the options a bit more. They want to feel like they have more autonomy. So when I was doing a GP rotation, I'd often say, okay, here's our options. Here's what we could do. And I think they tend to prefer that. Younger people in general tend to prefer that way of doing things. And what I do a lot on GP is send them reliable sources of information, because it can be really difficult to get like I said, Jordan, you can Google something, you can Google a symptom and be like, oh my God, I've Googled this rash and Google says I've got meningococcal meningitis or septicemia or something, really terrifying. And so information is so important to help reassure people, but also empower them. So there's this really good website called Patient Info that I would get articles from there, and you can send people a link to the articles, and it'll be great for patients because it'll say kind of what the symptoms are, what's going on, and treatment options, and it just empowers them, because when you've got something going on that you don't quite know, you're going to want to ask loads of questions, and you might forget to ask those questions. And so having something that you can do your own research and is reliable, I kind of found from the feedback that I got that younger patients really likes that.
I think that's where I'm a bit old school, because every time I go to the doctor, I'm like, just tell me what do I do? You know this all. Just tell me.
Yeah, I think I'd be like that as well. I'd just be kind of like, the odds of what option is better at treating people. And when I talk to patients, I would say, like, this is the standard treatment. This is the most likely to be effective. And sometimes there isn't other options. But I'd say if you did do nothing, these would be the most likely outcomes. So you give them the option that they could do nothing, but also inform them that if they do nothing...
Yeah, you've got two options. Either you take these pills or your head's going to fall off.
Yes, yeah. That is option number 2. Yeah.
What's behind door number 2?
Yeah. Or option number 3 is a mystery box. What's inside the mystery box? Yeah. Random pills.
Random pills. It's like Bullseye. one.
Pick and
Or
mix.
you could gamble your antibiotics for washing
The
machine.
wall comes up and it's just a studio audience. What do you think, everyone? Should he gamble? We've thought about it and we're gonna gamble. Yeah, we're gonna gamble on the washing machine.
We're gonna gamble. Oh, I'm afraid you lost the gamble, so you will lose your legs. Yeah.
But you've been a great sport. Give him a round of applause, everyone.
So we get that you're a Dr. George.
Mm.
We get that you're a Dr. George Cooke.
Mm.
Just, you might need to break it down for me for a bit as a layman. So you said originally that you worked in radiology, but then obviously we've been talking about, making calls to next of kin. And sounds like you've done a fair number of other things that wouldn't strictly fall within the scope of radiology. So how does that work? Was that when you were doing training? Is it you did rotations around other things, or do you do radiology as like your main thing, but you do other things as well, or different shifts, or how does that work?
Yeah, good question. So you do 5 years of medical school, or sometimes 4 or 6, but usually 5 years of medical school. Within that, you will tend to do varying degrees of experience on the wards or in different healthcare settings. So even whilst you're at medical school, often you'll be going to GP practices and you'll start seeing some patients there under the supervision of fully qualified doctors. When you then graduate medical school, in the UK, you do what's called foundation years. So you do foundation, you're a foundation 1 doctor, and then you do a foundation 2 year. And in those years, you do 4-month blocks of different rotations. So, for example, in my first year, my foundation year 1 as a junior doctor, I did 3 months working in orthopaedics, and then, 4 months in orthopaedics, and then 4 months in cardiology. And then during my F2 year, I did 4 months working in a GP practice, 4 months working in A&E, and 4 months working in general surgery. So you get quite a lot of experience in different areas of medicine and surgery. And then after you've done those 2 years, you can start to apply to specialist training. So halfway through my foundation 2 year, I applied for specialist training in radiology. And for that, obviously, you have to do some exams, you have to go to interview, and then if you get selected, you can kind of rank where in the country that you want to work. And so I got offered a position in radiology specialist training in Manchester. In radiology, it's a 5 to 6 year training program if you're working full time. If you want to do clinical radiology, the standard clinical radiology, it's 5 years. And if you want to do interventional radiology, it's an extra year, 6 years. So I'm halfway through the standard 5 years in radiology. So technically at the moment, I'm what other doctors would refer to as an ST3. ST stands for specialist trainee, and 3 means I'm in the 3rd year of it. And people will call that level registrar level. And that comes under the umbrella of junior doctor, which is quite a confusing term because a junior doctor describes anyone who isn't a consultant, basically. So a junior doctor can be a foundation doctor, it can be a registrar, it can be someone who has had 20 years experience as a fully qualified doctor, but because they're not a consultant, they're not, the very highest level that you could possibly be, they're still deemed a junior doctor. So the terminology can be quite confusing.
Yeah, it's the same with barristers. If you're not a King's Counsel, then you're a junior barrister, even if you've been a barrister for 30 years.
And some people choose never to be a consultant because it's a lot more responsibility and it can be a lot more stressful. So some people might just decide, okay, I'm going to, stay at the kind of equivalent registrar level. And I should say as well that often people will pause their training or they'll do the F1 and F2 years, which are mandatory in the NHS, and then they'll just work as like a general ward doctor and not be on a specialist training program. So they can be a lot more flexible with their shifts, but not get formal training. Does that make sense?
Yeah.
It's quite a complicated system. Basically, if you're a junior doctor, you can be on a training program or or sort of not, and sort of have your training paused.
And can you pause it indefinitely, or is it something that you can just come back to when you're ready? Or
Yeah, you can. People tend to take that pause before specialist training because once you're on a specialist training program, you need to complete exams and you need to show that you're doing this, this, and this. But if you don't go into a training program, you can just be a lot more flexible. So often people will delay applying to go into a training program to work in Australia for a couple of years, for example. Then they might come back to the UK and apply for a training program a bit later on. It just gives you a bit more freedom.
But I'm guessing you're in a better position after you do the training to move into. Well, I guess if you're going for being a consultant, the best thing to do is early on to do that. Because I'm guessing that's how you become a consultant in, say, radiology.
Yes, yeah. So after you've done the 5 years in radiology, if you passed all of your exams and you've ticked all the boxes, then you can apply for a consultant job.
Oh, that quickly?
Yeah. So in radiology, it's a run through training program, and if you kind of did a speed run to a consultant, you could graduate medical school, do your F1 and F2 years, and then if you get into radiology straight away, do 5 years of that, and then if you apply to consultant jobs straight away, you could technically be a consultant after 7 years after graduating medical school. It's quite
Wow.
rare because often people would take extra years out to gain a bit more experience, and sometimes they'll do like an extra fellowship year. It's quite rare that people will just gun through the whole way as fast as they possibly can. Because
yeah,
if
because
you
that sounds really intense as well.
yeah, it
Yeah.
is. Yeah. And if you're going to be a consultant, you need to know so much and there's so much responsibility. There is absolutely no problem in having a few extra years to gain a bit more experience.
So the extra year to do interventional radiology,
Mm.
you mentioned. What is interventional radiology?
Yeah. So clinical radiology is for the most part, interpreting medical imaging. So ultrasounds, X-rays, CTs, and MRI scans. You will write your report. You'll say what you see within the scan, and you'll you'll say, okay, I think this is the diagnosis, or it could be this and this, and you'll comment on the state of the patient as you see it. In interventional radiology, you're using medical imaging to help you do a procedure. So, for example, if on a chest X-ray or on a chest CT, you spot that a patient's got a nodule in their lungs that looks like it could be cancer, you can use a CT machine to help guide a needle to exactly where that lung nodule is. Because obviously you can't see the lung nodule on the surface and you can't feel it on the surface. So how do you know where your needle is in relation to the nodule? Well, you use imaging whilst you're taking the biopsy. So if you're doing it under CT guidance, you can take images to say, look, here's my needle and it's exactly in the lesion. And therefore I know that what I'm sampling is exactly what I want to sample. And as well as doing biopsies, you can put drains into areas of the body that you wouldn't otherwise be able to reach. If you're going really quite advanced, you can thread wires and catheters into people's blood vessels. And so in some of the extreme stuff, for example, you can close off a bleeding aneurysm by threading wires through someone's vessels in their groin, thread those vessels all the way up the body into the head, into the brain, and using imaging and contrast injections, you can see where your wires are. And you have to have a very good knowledge of anatomy. So you need to know the roadmap of all these vessels inside your head. And you can get your wire and your catheter to exactly the very, very precise location that you need it to be.
Wow.
And then you can coil and close that aneurysm. So you don't need to take a knife and open the patient up like old school surgery would. You can just do it with some clever wire manipulation. And you can get into very small, precise spots. And so the outcomes, because it's less invasive, can be better than surgery.
Wow, that's
Yeah.
crazy.
Some of the stuff they can do
That
is mental.
that is magic. That is actually magic. I mean, it's not, it's science, but it is magic.
And it's one of the reasons why radiology is always kind of at the forefront of medical sciences, because obviously, like MRI machines are quite a relatively recent invention in medicine and deals with some really high tech stuff. And using this high tech equipment, you can really achieve some quite stunning feats. And so radiology is always kind of pushing the boundaries of what you can do in terms of diagnosis, but also what you can do in terms of treatment as well.
Speaking of the medical procedures with radiology, you did in the break you mentioned that you had spent, was it a year or two in theatre?
Yeah, so between the degree I did in Bristol, the undergrad, which was anatomical sciences, and medical school, I worked as a healthcare assistant in North Bristol Hospital. What's it called?
Southmead.
Southmead Hospital.
Yeah,
Yes,
yeah.
I worked for a year in Southmead Hospital as a healthcare assistant in orthopaedic theatres. Healthcare assistants generally are on the low skill, low pay spectrum of NHS jobs. And so part of my role was kind of to clean the operating theatre between operations and kind of get kit for the surgeons and for the scrub nurses and sort of be a bit of a runner and kind of do sort of odd jobs. So you're working with surgeons, with scrub nurses, with the anaesthetics team, and you've got a high turnover of patients. And it's quite an exciting, fast-paced job, really, because you're still a small cog in a big machine, but the machine basically is operating on patients in quite a invasive way and can do quite miraculous things. And the machine that you're part of just feels like you're doing very tangible good for the patient.
Yeah, because you're
Yeah.
so close to it.
Yeah.
You're
yeah.
close to the action.
Yeah. And yeah, you are very close to the action. And sometimes it can be quite funny seeing that interaction of patient and surgeons when the job is being done. So obviously when the surgeon goes to see the patient, beforehand, when the patient's, waking on the theatre, it's quite a nice fluffy environment, and you're explaining what's going to happen. And then when the patient's in the theatre, it's kind of all business then. And the surgeon's kind of in a sort of different mindset. And a lot of what the surgeon's having to deal with is quite sort of higher risk stuff. When you're kind of cutting through patients' tissues and, you want to avoid that big artery, and, you can kill patients if you fuck it up in quite a serious way. So the surgeons tend to be quite big characters. And when I started there, I kind of wanted to make quite a good impression and kind of introduce myself to everyone. And then it was probably my first actual paid job, because everything before that was just, volunteering and working on the farm stuff. So yeah, I was quite kind of bright-eyed, bushy-tailed, wanting to make a good impression. I went up to the surgeons and I said, "Hello, I'm George, one of the new healthcare assistants here." And he kind of took my hand, like gave me a very firm handshake, as kind of old world surgeons do. And as he shook my hand, he kind of pulled me in quite close. And he said, "Bloody well have a shave the next time you show your face here again." And I was like, "Oh my God, bloody hell. I'm in here with the big boys now." So I was like, "This is terrifying." And then when he was operating later on, he'd go, "The patient's on the table, all the instruments are basically inside the patient." And he's going, "George, get over here." And I'm like, "Yes, Mr. So-and-so." And he's like, "Go get me the long weights." So I run off and I was like, "Yes, Mr. So-and-so, I'll go and get them." Because that's part of your job, is to get any equipment that they need you to get. I know, I was so naive. And then so I ran off to the store cupboard, and I still didn't know. There's so much equipment, and all the equipment has really bizarre, funny names. You've got like the Charnley bow. There's a piece of equipment called the Blade Runner. Yeah, yeah. And so I asked one of the guys in the store cupboard, I was like, where's the long waits? And the guy in the store cupboard just kind of like gave me a smile. And I was like, oh God, I've been had here. So I went back into the theatres and I was like, well done, Mrs. So-and-so, you've got me. And then he was all smiles from there and he was all like jokey. And I was like, oh, this guy just plays practical jokes. That's just part of their kind of personality. And some of the surgeons are kind of odd personalities or kind of wacky and scary. So yeah, you do get a lot of odd people working in that environment.
In
And also
surgery,
sometimes
though,
they can get, yeah.
to do that. I mean, I've heard that happen when you first start out as like an apprentice on a building site, and someone says, "Can you go get me the spirit level bubbles and some tartan paint, you know, and a skirting board ladder and stuff like that?" And but not in surgery when you got someone opened up in front of you.
Oh yeah, but the kind of, because it's so kind of serious and sometimes life and death, you have to kind of make it a bit jokey and a bit more lighthearted and inject some humor into the situations. Because sometimes, you know, when the surgeons get really stressed out, there's one surgeon who would throw heavy metal equipment across the room because he was so enraged or frustrated because it was so high stakes. And sometimes they would shout at some of the members of staff something awful, but it can be a really fun, friendly working environment. Sometimes it can be awful.
But I guess in that sort of situation, if you're the one being shouted at, you've got to take it, haven't you? Because it's like, well, we've literally got someone's life on our hands right now, and if
Yeah,
it's going to make you perform your job better, then I'll take the dressing down. Do you know what I mean?
I mean, it's an old-fashioned way of thinking because now, you know, in the NHS, people say there's no excuse for talking to people like that. You can't treat staff like that, which, yeah, you shouldn't be treating staff like that at all. But we're all kind of, you know, under the collective agreement that these surgeons are under a lot of stress, and it's not surprising if it's going to come out badly sometimes, you know, when they're going to lash out. And again, it's not acceptable for them to act like that, but, you know, sometimes you kind of just
I guess if you're in like the army or something or somewhere else where the stakes are really high, there comes a point when you can't really, it can't be in reality be all lovey-dovey. You know, it's easy to be all lovey-dovey in like an office where nothing really matters apart from like whether the shareholders get an extra 5% on their dividends. But, you know, if it's like someone's going to literally die or, you know, your country's going to be invaded and taken over or something like that, you can't really, the niceties have to be dispensed with, unfortunately.
And the surgeon's way of thinking, but really all of our jobs is to facilitate the surgeon doing their job, because the scrub nurse, you know, has all the equipment provided for the surgeon. The anaesthetist anesthetizes the patient for the surgeon. I'm doing my job directly to, you know, help the surgeon as well. Everything we're doing is to facilitate them to do the job. Although technically, if you're going to list the importance of people in that theatre, the most important person is the patient. The second most important person actually is the anaesthetist, because they are actually directly responsible for whether the patient lives or dies. It's their responsibility to keep the patient alive, because if, for example, the surgeon makes a mistake and they're hosing a lot of blood, it's the anaesthetist's job to make sure the blood pressure is fine, and the anaesthetist's job to make sure they've got the blood transfusions and to make sure you know, they're breathing adequately under anesthesia. Yeah, it's the anaesthetist's job to keep the patient alive and manage all of these complications.
I always imagine that the anaesthetist puts them to sleep and then just sits there for a few hours until until it's time to wake them up.
They just go, right, well, that's me done. I'm going to go for a fag.
Yeah,
See you later.
I mean, a lot of the anaesthetists would, as soon as they put the patient to sleep, put their feet up on the anaesthetics machine and start reading the Times or the Telegraph, and, you know, be munching on the sandwiches in theatre, even though strictly no food is supposed to be allowed. So when everything is going plain sailing, it's probably relatively, you know, an easy job. But when shit hits the fan, that's when the anaesthetist really has to earn their money. like I said, if the patient dies, it's often the anaesthetist's kind of responsibility.
How often did that happen when you were in the theatre, that the patient died during the surgery?
Don't think anyone did actually, because I was in orthopaedic theatres, a lot of the operations were hip replacements and knee replacements.
Just so people, in case people don't
Yeah.
know what is orthopedic.
Oh, sorry. Orthopedics basically means bones and joints. Yeah.
Okay.
If you're going to go into like the Latin or the Greek of it, ortho means to straighten, and peds comes from pediatrics, children. So the original orthopedic surgeons their job was to straighten children. So children with rickets that had bowed legs.
Oh,
It was their
wow.
job to straighten the bones of children with rickets. But basically, orthopedics means bones and joints.
So an orthodontist is someone who straightens teeth?
Yeah. That fits.
The end.
No argument there.
And an author is someone who straightens letters on a page?
No, ortho. O-R-T-H-O.
Well, I think that it's time to move on to deciding, George, if you were not in the noble profession of doctorhood, what would your dream job be? Any initial thoughts?
Yeah, so, well, this is quite something different from the rest of what we've been talking about. I love when you're playing video games and you get to create things. Where
Like The Sims?
Yeah. I kind of love city building games, and also games where
I've done them.
City Skylines.
I'm playing City Skylines
what a
2 at
game.
the moment, and yeah, I'm loving it.
What a game. Yeah.
And I also love games.
And then you destroy the city with tornadoes. Well, that's what I did.
I also love games where you can sort of create the environments and the landscapes and the kind of buildings. There's one game. It's a Viking survival game called Valheim, and it's very basic elements that you can build with, but you can make some amazing things. And I guess what job I would want to do is be able to be in some kind of simulation where I can just create everything, landscapes, cities, creatures, but I'm not techie, so I couldn't use kind of today's technology to sort of write code for that. I'd kind of want to be in that environment and kind of shape it as I'm walking around it. I kind of love that.
You want to actually do it in real life. That's what you're saying. That would be your dream
Yeah,
job.
like,
you're able
I
to
imagine
build a city from scratch and then get people to move.
Yeah, like I imagine in a couple of years' time, we'll be able to enter some kind of simulation, and we'll be able to sort of, change it with our minds. And, maybe the job is creating that for games, or maybe it's just purely, what I'd want to do.
Maybe you could almost make it like a VR thing where you can put on a headset and then you enter that world of that blank canvas, and it could almost be something like a mayor of like a new city or like a council come to you and they say, we want to build this new city and we need your help to do it. Enter this like VR space and help us build it and craft it.
As in you design it that way and then it gets built in the exact way that you've designed in the VR.
I just love the idea of being able to walk around or walk through something that you've kind of created and designed. And that doesn't even have to be like a building. It could be like a beautiful landscape that you've kind of crafted.
You could be a landscape gardener.
Yeah, but I'd want to like go beyond the realms of what's like physically possible. There's going to be like, some mountains in the background here and like
Right. Okay, well, I mean, I guess since this is your dream job, it could be that you can, we say, okay, here's 15 square miles in the English countryside with nothing on it. You can be like God, put
yeah, that's what I want to be. I want to be
build
God.
buildings, then build.
Yeah, I'll take that job.
It's not really a job, is it? Well, it's a kind of demigod, I guess. It's a god with a remit over a small bit of land, and you can do whatever you want.
I'll be the
You
god
can do
of
whatever you want
like
there.
Sussex or bow before me.
That is your
Sussex,
nickname, isn't
I am
it?
your god. Yeah.
Would you not want Cheshire, though? A little bit of undisturbed land in Cheshire where you could make a city or a
Well,
town
Cheshire's
and.
quite flat, really. I'd want to kind of.
Well, yeah, but you
Yeah,
can you can change it
sculpt
up.
Yeah.
it.
Because there are those in some of those city building games, you can like click on a bit of ground and it lowers or rises, can't it? Like you can
Oh,
make valleys and mountains
Jacob,
and
you're hardly
whatnot.
scratching the surface there of what I would do as the god of Sussex.
Okay, well let's imagine then that we've got okay, we're in Sussex. We've got
I don't know why I
the
picked Sussex,
15.
by the way.
Oh no, but let's roll
Yeah.
with it. We've got the 15 square miles or however much
Mm.
you want, but enough play to build a city or a conurbation of some kind. Explain to us, design for us, what is Georgetown?
It would have to be a kind of classic high fantasy, rustic, medieval looking, but a bit sort of magical twist. Basically, a quest giver hub if you're in a kind of computer game. Somewhere that's going to have, like,
Yeah.
the blacksmith who needs you to collect, like, 15 iron or whatever. And it's got to have the classic high fantasy inn with some colourful characters in there. It's going to have temples, stables, a lively marketplace, filled with jolly characters, colourful scenes and scenarios, cobbled streets. Yeah.
So you're more interested in the details rather than in the overall like the town planning kind of aspect.
Oh, I'd also be into the town planning as well. Yeah. So I'd make sure, all the sewers are running as they should be.
underground.
Yeah. Yeah. Where you might have one patch where the sewers are, not running quite as well to make sure that shady part of town feels shady, where the kind of thieves and
Right.
assassins kind of hang out.
You might have a lagoon
Yes.
even.
Yes, exactly. Yeah. Less tropical lagoon.
Is this a town that you would live in, or you would just design it and say, my work here is done, and you would retire
And then destroy it with tornadoes.
Yeah, I think I probably would like to live in it. I'd probably give myself quite, a nice, cozy, cushy place to live in it. I wouldn't want to be like mayor of the town. I wouldn't want to be famous in the town, but I would want to, I want to live and I want to like walk around it and kind of really soak up the feel and live in it. And also so that if I'm living in it, I can kind of chop and change it how I want.
Do the people of the town know that you built it?
No, they don't know that I am their god. No, I
like
wouldn't want to
that.
be. I wouldn't want to be
You
famous.
can walk amongst
Yeah.
them. You can walk amongst them as common
Yes.
folk, and they never know.
Yeah.
And are you still a doctor in this scenario?
Yeah, I could. I'm not sure that radiology lends itself quite well to the kind of high fantasy medieval setting, but
Yeah, because I guess I'm thinking this is a dream job. So the job isn't that you create; it's a one-off. You just create this place and you live in it, and you stop working then. Or is that is that your dream job? Is that you then retire and that you just then wander around this place that you created?
well,
the
I
rest of your
guess
life?
the job is that you are, because it's going to take a long time to create this, right? So you're always going to be adding bits and improving on it, and kind of steadily building it, because with these things, you're never kind of like, okay, done, and that's it. So I'd always want to be playing like an active part in it, in this world.
And obviously, you're gonna have the people who live in the town saying, "We need a hospital in the town, and there isn't a hospital yet."
And you'd say, "Oh no, but you're not allowed to have the medicine because that's too modern."
I say, not yet.
Wait, be patient. Or a house might burn down, and they say, "Oh, we haven't got a fire brigade. We need."
Well, I think they've invented water, Jordan, by this point in history.
Yeah, but there's always expansion. There's always the place is always growing, and obviously you've got more people moving in. So I'm really thinking about city skylines here, where you have more people moving in, and then you need to build more houses and zone more places, and it could be sort of ever expanding.
And I don't mind, obviously, because in this sort of world, I have to kind of masquerade as someone who is, part of the community. So I wouldn't mind doing a bit of like low key medicine on the side, help the
Loki medicine.
yeah,
The
illusionary.
Viking trickster god.
Yeah, yeah. So maybe I'd help like
Oh, you
set
could-
some bones, fractured bones, or like
Yeah, the kids with rickets,
exactly.
straighten them out.
Yeah, those bendy kids.
Well, if it's within high fantasy, you could be like one of those doctors who just gives leeches to people.
In medicine they sometimes they still use maggots. So
Ooh.
Why?
So if you've got a really nasty wound, the maggots will only eat the dead tissue. They won't eat living tissue. So sometimes they, will put maggots on there as a way to clean the wound. But obviously you don't have just like maggots like crawling all over the place. They kind of sort of kept under like a lid on the wound. But it's just so crazy to me they still use that.
So you just cover the wounded maggots and bind them up,
cover.
and then wait until they've eaten all the dead flesh. You've got a supply of maggots then, George, in this in your house in this town.
I think I would kind of have to employ, if I'm going to work as a low key doctor in this place, you'd have to crack out the leeches and maggots a little bit, just to be in character. Few kind of dodgy herbal remedies.
And what if the locals started calling you Dr. Maggots?
I think I'd be all right with that, actually. That's quite a cool name.
You wouldn't send in a tornado?
Dr. George Maggots.
Dr. Maggots. I think if people call me Dr. Maggots, that would give me an excuse to like hunch over and like put on a voice. I just have to become Dr. Maggots.
Yeah, and then you're back doing some of your characters. You can you can fit in some character work.
Come full
and
circle.
then when Dr. Maggots dies, I'll have to assume the role of like some other weird and wonderful character. Yeah.
So I want to know more about the town or the city, because I know there's a market and a pub and your house and things like that, but and it's quite old fashioned, so there's no electricity, or is there? Are there cars? Are there roads, or is it horse and cart, or what kind of place in it? And then how big is it? How many people live there? What's the ideal? Because you want to have enough. You want to have enough stuff. Because if this is your job, if this is what you want as your dream job, then you're living there for your working life at least, and doing little changes and improvements and additions. It's going to need to be meaty enough.
Well, it's probably going to kind of start off small and get bigger and bigger. I think that's going to be one of the most satisfying things in it, is watching it grow. But no electricity. Maybe the Wizard's Tower has some kind of like slightly steampunk looking magical items in there that might resemble a bit of, electricity and technology. But that's
the Wizard's Tower?
Yeah, where the wizard lives.
Obviously, Jacob.
Oh,
I was wondering whether there were going to be some steampunk elements.
Purely as a kind of magical curiosities. Yeah.
You don't want to be the
maybe
wizard.
when Dr. Maggots dies, maybe I'll assume the role of the wizard.
But you are Dr.
Oh,
Maggots.
yeah, but
That's
like in this situation, I'm kind of immortal and and I'm overseeing the whole lives. And so Dr. Maggots can't be seen to be around forever, else he'd arouse too much suspicion.
So you're there throughout time as different characters. A bit like Doctor Who, you're always, well, not like Doctor Who actually, because you always look the same, but you're there, you're always there, but in different costumes, I'm imagining, with a slightly different voice and posture.
Most of them hunched
over. And I guess
over.
then if you're,
that's the.
And then if you're immortal, presumably you live to see this city become a modern city with electricity and whatnot.
Potentially. But the thing is about fantasy is that in most kind of fantasy situations, these kind of the way of living goes on for thousands of years. Like
it's fantasy land, isn't it? So it's like if like Middle Earth in 500 years time isn't like Los Angeles.
Exactly, yeah.
Still,
I mean, that's the classic example. In Tolkien's world, if you're looking at what happens in the event of The Lord of the Rings, it's like 10,000 years after, civilizations first started, and they still not even got, crossbows. Or no, actually they did have crossbows in the second film. So
he overlooked
they
that
only
one,
just got
the idiot.
Tolkien, idiot. Yeah.
I think if I was there, I would have made a car by now, mate. So
Yeah, I guess in actually that is one of the points of one of the plots in the films is that the Industrial Revolution does actually start in that part of it. But yeah, going back over the history of Middle Earth, it's been thousands of years, and they've just still got the same technology. So maybe it's kind of frozen technologically in time, but the city still develops.
But do you, in your house, have like a TV and things? I presume you'd miss some of those things if you go from your life
Yeah.
now in 21st century Britain. Everyone else is doing whatever they did back then for entertainment. Honestly, what I just imagined was that thing you see in films where someone's got like a hula hoop they're pushing along with a string. Whatever that is. I've never understood that. How does that work physically? If I had a hula hoop,
push the hoop along with a
but
stick,
how?
don't you? Yeah.
The hoop would fall over, wouldn't it? Like straight away if I
I'm
did
sorry,
it.
but what on earth are you talking about?
Do you not know what we're talking about?
No. What's the hula hoop got to do with any of this?
It was like a Victorian London sort of thing, wasn't it? Where people it was like little kids. It'd basically be a hula hoop, and you'd push it along with a stick.
Oh,
and
yes.
the aim was that it would just keep rolling. Yeah.
Did you think we meant the crisp?
I had no idea where hula hoops came from in this conversation.
Well, I've just Googled stick pushed along with... no, it's because I've Googled stick pushed along with a stick, not wheel pushed along with a stick.
Does it have a name?
Okay. Hoop rolling, also called hoop trundling, is both a sport and a child's game in which a large hoop is rolled along the ground, generally by means of an object wielded by the player. The aim of the game is to keep the hoop upright for long periods of time or to do various tricks.
Fascinating.
So anyway, my point was that the people of your town are all busying themselves with medieval pursuits of some kind. But do you have like a PS5? And when people come around to your house, maybe you've got like a secret room in your house, like you pull a book out of a bookshelf and a secret hatch opens, and then you've basically got like a modern bit of a house in there, so you don't lose the creature comforts of the 21st century.
It would be nice to be able to step out of this world and have a bit of a holiday of the modern world and the creature comforts, like you said. So maybe this is just a 9-to-5 job, and outside of that environment, I just live as I kind of in the world.
I'm very on board with that.
That would be ideal, really,
because it's a job. Yeah, job isn't your whole life.
Exactly.
So if you're in this world and someone's like, "Oh, do you want to do something this evening?" You're like, "Oh, I'm sorry, I can't because I'm." And then you can't say, obviously, it's because I'm gonna teleport back to the real world or something. But
sorry, I'm gonna jump on Fortnite with the boys.
Yes.
So I can't come to the inn tonight.
I'm going back to the world I live in. That's going to be completely unimaginable to you in every conceivable way. Blow your noodle. Yeah.
So I was just gonna scroll on TikTok, so I can't really do anything.
Yeah, no, I quite like that, because that is, that makes it more of a job, really, isn't it? It's not like, you're not in residence necessarily, but you have a base of operations within. I mean, you can still have like a little TV or something in there, can't you? Just for during at lunchtime if you want to kick back and watch a bit of work and lunch or loose women.
Or watch House, as I'm sure you
love.
love.
My
as I'm sure
God.
all doctors love.
When I watch House and they come up with the most ridiculous plot lines. Oh, the most frustrating thing I've seen on House is when they go through the whole story of like, oh, what's going on with this patient? We just don't know what's going on. There's all these twists and turns. At the end, the patient's got all these weird, bizarre symptoms because they've got high calcium. And you're like, that's one of the first tests you do when the patient comes through the door, is to like look at their calcium. Oh, God. Sorry. I could go on a rant about those TV shows.
I mean, I think that any member of a profession who watches a popular show about their profession hates it because of how wrong it is.
Friend of the pod, Lucy, would try and get me to watch these medical shows or documentaries, and no, it's too much. Busman's Holiday.
Do you feel like with what we've discussed so far, is there anything missing from this job that you'd want to include?
Do you want to get
Ooh,
paid?
yes.
Something that's actually never come up on the
I'd like a
podcast
good
before is
salary.
so that it's not that this is enough of a reward in itself that you get to do this. You need to
Yeah,
be
because
paid as well. Well, I guess you need to live back in the
exactly.
real world, don't you? And
Yeah, if I've got
yeah.
my evenings and weekends, back here in my
Yeah.
real home.
So you want to get like a decent salary,
I
maybe
guess
like
if you're
performance-based bonuses based on how many new additions you make to the
that'd be good.
city and how because it could be because don't in these games sometimes you have metrics like how I can't half remembering, but you have like how happy the people are and various other things. So that could tie in.
And if you're making a business out of it, I guess you could make it a tourist industry. So, getting people from, our world, letting them visit this world as well and have a stroll through and maybe go on a few, fun quests or whatever. And so maybe that's the business model is selling the ability to enter that world.
Yeah, because I mean, it didn't even occur to me that you would, at the very least, I guess, want to be able to bring friends and family and show them what you've
if they're
done.
paying.
And
yeah. Great.
How much would he charge?
There's no free trips.
How much would I charge? I think I'd charge £30 an hour.
I honestly
love
think
that. That is a really funny amount of money for something that you could obviously charge way more than that for.
I think that is more than reasonable, George, for what you're
Yeah, but
offering. You can teleport to a high fantasy world and spend a day there for 30 quid an hour.
But like, if you're going for a whole day, if you're doing like just 10 hours, 300 quid for one day.
Yeah, but you could charge £3,000 an hour, and then you could get 300,000.
Yeah, there's like package holidays that cost more than that to
I guess,
Magaluf.
I get. I mean, maybe George, it's just your caring side coming out that you're thinking about the people who might be less able.
I mean,
to
I
afford.
want to make this accessible.
Right?
And
exactly.
Maybe I'll have like student discounts or like
blue light discount, I guess.
Yeah.
Yeah.
What's it called?
Like uni days, like 10% off for students.
Yeah. And I guess you could have a little like cardboard thing you give people and they can get a little stamp. But if they get 6 stamps, they get 1 trip free.
Yeah. Oh, and I definitely sell it to schools as like, I think it'd be great if you had like a class of children who are able to go along and see it, because like kids love being taken to like open air museums and stuff, and you could do like a Pied Piper kind of thing, couldn't you? You could kind of like lead the children through with a little man playing the flute, and he'd guide them through the towns. Yeah.
So is this actually how you get money? You don't have a salary, but you get the money through charging people to come in, or do you have both?
Why not
both?
Why not both, Jacob?
Yeah, you can have both. Yeah. I mean, I'm not gonna. Yeah, the only problem. Well, there are many problems, I guess, but quite a big problem I can see is if this town is populated with medieval people who have no idea that the modern real world exists. Will they not be a little bit freaked out by the fact that lots of people from the real world in modern clothing are going to be coming and walking around like on tours and things, and also
have to dress up. Yeah, it would be quite. It would be quite.
And they're not allowed to talk.
They're
to the
not allowed
locals.
to break character.
Like they're visiting North Korea, basically, when you're not allowed to talk to any of the locals, and you can only go into certain areas.
Yeah, it would have to be a strict set of rules that you'd have to follow. You'd have to dress up. Limited interaction with the locals. If not, it's got to be in oldie worldy, high fantasy. And one slip up, one like mention of a mobile phone, and like you're out, you're banned, you're blocked.
Well, I've got to say, I absolutely love this.
Well, I will charge you. I'll charge you a
this.
discounted £25 an hour.
Oh, that's really nice. How do just another detail that I'm interested in is how does the process of getting from the real world to this world work? So, do you have an office in the real world that people show up to, and then you kind of pull back a blind, and there's a big swirling portal or something, and you say in through this way,
Yeah.
please, into the, and then they come out in your house
think
in
to
your
avoid
world.
suspicion, they'd have to come out of they'd have to emerge into this world from outside of the town and then walk into the town.
Right. Okay.
So that there'd be some kind of portal, under a bush or whatever, and they'd have to walk into town, and they'd sort of have to say they're from somewhere out of town. Yeah.
Yeah, that would start to get suspicious, wouldn't it? After a while, when there's so many people who come in,
Yes.
and people ask, "Where are you from?" You go, "Oh, yeah, just out of town," and you've got 50 people saying that every day coming into the town.
Yes.
Eventually, we're going to wonder, who are all these people? But I mean, you really have to earn your money, because there would be a lot of careful engineering of things from behind the scenes you'd have to do to maintain the social order and avoid confusion and suspicion among the population, while they don't know that you're the person that's in charge of this
I'd probably
city.
have to be quite ruthless in terms of crushing any conspiracy.
Okay, we're getting
if
dark
if
now,
any of
but
the local townspeople are thinking, I think there's a conspiracy here that our whole world is made up and it's just a tourist attraction, I'd have to stamp that out. Yeah.
Okay, how would you do that? Keep it light.
I throw them in the lagoon.
To the lagoon with you. Traitor.
There we go, tying it back.
Witch.
Tying it back.
Witch. Heretic. He speaks of conspiracy to the lagoon.
Well, unless there's anything else you want to add to this, George. I mean, we've got everything. We've got the job, we've got the working hours, we've got the means of making money, and you have, I think, included anything that you might want to do. You've got the childhood interest in playing The Sims and everything. And you can kind of do anything really within that world, can't you? You can do the medicine, you can do, it's got it all. So I think that we can shake your hand on this.
Thank you
job.
very much. Thank you very much for my dream job.
You're welcome. And thanks a lot for the £5 an hour discount to come into George World.
Meet straight, so I can do you a deal.
Yeah. Thanks. Yeah. We'll talk about that
off
the podcast so that the listeners don't get jealous.
Yeah.
Wink,
and for
wink.
the listeners, you can use discount code X7Z.
This episode is sponsored by George World Enterprises, Inc.
Well, thank you so much for being on the pod, George. This has been a really, really interesting, winding conversation. And I really hope that anyone who listens to it, maybe if they had any interest in medicine before, it's really piqued their interest into getting into it, but also given them a bit of a peek behind the curtain of what to expect.
Well, I hope I haven't put anyone off. If you are interested in getting into it, you have to have you have to do plenty of soul searching, and you have to be very aware of the practicalities of the job. So if you are interested, do get some experience in hospitals, try and do some of that volunteering work, because the idea of medicine and working in healthcare, it can be romanticized, and you just have to know that, if you want to do it, it's something that you really want to do, because it'll be very rewarding, but it's not for the faint-hearted. But thank you very much for having me on the pod. I've absolutely loved speaking to the two of you again. I've had some good old chortles along the way.
Yeah, well, we've loved having you here. Thank you very much.
I really want to go to that town, Jordan.
Yes, the whimsy-timsy town of fiddle-dee-dee and dragons and dark alleyways with pickpockets in the night.
That does actually sound a little bit like George. Were you trying to do an impression of George there? Yeah, or maybe it's just me. Sorry, George, if you were listening and that offends you. I thought that sounded a bit like you. Um, that was I think a few of the episodes we've recorded recently, including some that haven't come out yet, there is nothing, or basically nothing, in anything leading up to the dream job section that could lead you to predict what the dream job will be. And I love how we got to the dream job section and it's straight into being a demigod over a little city,
Yeah. Yeah.
but only during working hours. I love that. That's one of my favorite. I guess probably say this every episode. That's one of my favorite dream jobs that we've had. What an imagination that man has. He didn't even stop to think that maybe his dream job would be a real job. It'd be like, no, straight into his fantasy world that he indulges in when he plays those city games. Lovely.
Yeah.
I loved it.
Yeah, it was brilliant. Absolutely brilliant. And I guess if I were to dream up sort of like a high fantasy world, it'd be one where everyone who listens to this pod gives it a 5-star rating on any podcast platform that they listen to. And I know that sounds crazy.
God, check out J.R.R. Tolkien over here.
It's Jordan.
Jordan Tolkien.
Jordan Tolkien.
Yes. Yeah, no, I definitely think that it would be a good idea to go and follow our accounts, because that will make it easier for you to see the episodes when they come out, because that's where we post them.
And also, if you've got anyone who you think would be good on the pod, drop us a message on any of the socials, and we can get in contact with you. We can link up. We can sort something out.
So it's almost the end of Careers Mare for 2023. We've got one more episode, and that is the Christmas special, episode 9.
Oh,
And we will not be releasing it on our usual bi-weekly cycle, because if we did, it would go out on Christmas Day, and we don't think that anyone would listen to it if we did that. So we're going to release it on Friday, the 22nd of December. So keep an eye out for that. It's a really, really special one, and we are both extremely excited for you all to hear it. And the person who we will have as a guest is amazing. So yeah, tune into that.
oh, I cannot wait for that one. Really,
Yeah.
honestly, everyone, you need to listen to that one. It's really going to be a special one. Really, really special.
Yeah, and then don't worry, we're not going anywhere, because we'll be back straight after Christmas. Well, not straight after Christmas. We'll be back in the new year with episode 10 coming out on the 8th of January. So then we're back to our fortnightly cycle.
We never stop. We're
We
in
never
your
stop.
ears.
We never sleep.
We're in your ears. We're in your mind. We're in your job. I'm in your job. I'm in your office. I'm watching you. I'm thinking, will they be good for the pod? I'm taking notes.
Yeah, Jordan does think all those things and more. And if you want to hear more of his thoughts, keep listening to the Careers Mad podcast. And also, one last thing, since we're going into the Christmas break and people will be, hopefully you'll be working less and having a bit of time off, please do go back and catch up on our back catalogue. We've gone through 8 episodes now. We've had some fantastic guests on, and they're all up on Spotify, Apple Podcasts, Amazon Music, etc., etc. So go back and listen to them. They are all fantastic.
Now, get out of here, you lot.
Clear off. Come back on the 22nd.
Bye-bye.
Bye.